In this video, we will discuss the International Patient Safety Goal, reduce the risk of patient harm resulting from falls. Many injuries in hospitals are a result of fall. 35 to 45% of people more than 65 years fall each year. In nursing homes, more than 50% of residents fall annually. In hospitalized patients, more than 25% of falls result in need for hospital care. Each hospital should identify types of patients who may be at high risk for falls and follow these 5 steps to prevent it. Identify risk factors for a fall. Screen all patients for fall risk. Implement interventions appropriate to assess risk for cases having a score more than 25. Reassess patients for significant change in condition for a fall, and manage and report all falls. Risk factors for falls are divided into intrinsic and extrinsic. For the intrinsic, we have history of falls, mobility impairment, muscle weakness, visual deficits, cognitive impairment, postural hypotension, agitation, urinary frequency, depression, arthritis, and age over 80. For the extrinsic factors, we have medications, poor lighting, and loose carpets. Fall risk criteria identify the types of patients who are considered at high risk for falls. These criteria and any interventions applied are documented in the patient's medical record as they provide the evidence to support the patient's fall risk category. The documented criteria facilitate the continuity of care among the healthcare practitioners caring for the patient. Screening generally involves performing a simple evaluation of the patient to determine if he or she exhibits a fall risk. Screening tools are commonly used and include questions or items that are used to identify fall risk patients. For example, the questions may require a simple yes/no answer, or the tool may involve assigning a score to each item based on the patient's response. This is an example of a fall risk screening form, showing different criteria to be assessed on the left column, with corresponding score if present. If fall risk assessment total is more than 25, we should start preventive measures. Pediatric patients require a special assessment tool. It's also important to reassess patients with significant change in condition or who actually fall. Significant change in condition include at least surgery and/or anesthesia, narcotic administration or any drug affecting central nervous system, change in ambulation, change in level of consciousness or mental status. Interventions taken when patient is at risk for fall include bed alarms, moving patients to room near nursing station, sitter for agitated patient, placing patient's mattress on the floor, chemical restraints, or physical restraints. Each hospital should establish a fall risk reduction program based on an appropriate policy and evaluate patient fall should he follow care and take actions to reduce risk. A fall reduction program includes, in addition to risk assessment and reassessment, evaluation of environmental conditions that might increase that risk, such as that conducted during periodic safety tours. We have some specific situations that can pose a risk for fall. For example, when a patient arrives at the outpatient department from a long-term care facility by ambulance for a radiologic examination. The patient may be at risk for fall in that situation when transferring from ambulance cart to exam table or when changing positions while lying on the narrow exam table. Specific locations also may present higher fall risk because of the services provided. For example, physical therapy department has many types of specialized equipment used by patients that may increase the risk for fall. In outpatient department, the hospital should determine those patients whose condition or location need to be assessed for fall risk. For example, physical therapy patients again. Patients arriving from long-term care facility by ambulance. Outpatient anesthesia and surgery. Patients with gait and balance disturbance. Patients with visual impairments. Pediatric patients under age of 2, and so on. Strategies for fall prevention. Education of staff. Review and modification of medications. Exercise and balance training. Modification of environmental hazards. A case study. One patient who was identified as being a fall risk. The following precautions were taken. Bed rails up. Bed in lowest possible position. Call light immediately accessible. Patients told explicitly, call nurse if you need anything. Patient placed in area with many nurses nearby. Bed alarm activated. The patient stated he did not want to be restrained. The next evening, the patient attempted to climb out of bed by squeezing between his bed rails and fell to the ground. The patient was found on the floor with no signs of injury. He agreed to be placed in a pussy overnight. 2 days later, he was transferred to the medical ward. The nurses identified him as being at very high risk for falls and thought he should be placed in restraints, but he adamantly refused. Because the staff believed the patient to be competent, they did not feel they could restrain him against his will. No psychiatric evaluation was requested. That evening, the patient fell for a second time while trying to get out of bed. He was found on the floor, bleeding from his mouth. There were no new neurological findings. Repeat head CT showed no increase in the size of the subdural hematoma. The lip laceration was stitched and the patient was placed in restraint over his objections. Conducting a root cause analysis revealed that floor nurses were not aware of patient's previous fall in the step-down unit. Efforts to put the patient closer to nursing failed due to a lack of bed availability. No high-volume bed alarms available. Bed alarms in use inaudible at nursing station. Sitters not available due to budget restrictions. System improvements. Enhance communication. Parcellets to identify patients at high fall risk. Checklist. Risk factors reviewed on sign out. Maintain mobility. Balance risk of falling with benefits of activity. Avoid cascade of functional decline. Seek financially feasible alternatives. Sitters, solicit family members. Reserve beds near nursing station for at-risk patients. Thank you.